Hello, back with Dr. Nazari. Dr. Nazari, veneers and lumineers. Most of us patients are a little foggy about it. We don't quite know what is one. And to me, they're all clip-on fingernails, clip-on tooth nails. But tell us a little bit of when one is more used versus another one. Is there a price difference majorly or not? Just let us know.
Well, the first thing is that I suggest to my patients, and I highly recommend to all my patients, that they should not go with what they see in the TV advertisement or they hear in the radio advertisement. They need to consult their dentist, their tooth healthcare provider, or whatever you guys want to call us first before they go and they tell them, I want this or I want that. It's not like going to a supermarket and getting a brand of cereal or getting a different type of shirts or a shoe. Every patient is different. Every teeth or every tooth actually is different. They need to consult their dentist before making a decision which one they want to go. Basically, both lumineers and veneers, they fall under a broad category which is called cosmetic dentistry. If patients have good, lined up, properly shaped teeth, and it's just a discoloration of the teeth, they can bleach them in many, many cases. So that is again a cosmetic dentistry. It gives them a beautiful white smile. If the patient has crooked teeth and which teeth are not lining up properly, they can get braces to make their teeth straight, which is again cosmetic dentistry. Or they can get what is called veneers. Veneers versus lumineer is that when you're talking about veneers, most of the cases you have to go ahead and then remove some tooth structure to make the teeth line up properly with the rest of the teeth in order to look all straight. Lumineers are the type of veneers that you don't need to remove any tooth structure. You can just glue them or cement them on top of the teeth, which I suggest for my patients if they have straight teeth. If the teeth are not straight and you need to shave from the teeth, then you go to different material which fall under a broad category as called veneers.
I see.
So again, lumineers are just for straight teeth that you can just snap on. Just like if you want to call it a snap on, you just cement it on, and then it changes the color of the teeth, basically. And if the patient needs to have to get some bulk under the lips, you can do that. But if the patient has crooked teeth, then they have to resort into shaving teeth, which again you can still get lumineers. It's just lumineer is just a brand name of a type of veneer. It doesn't mean that you cannot get lumineer if you end up getting your teeth shaved or your teeth prepared by the dentist.
I see. So basically, for all purpose for us patients, both of the things are the same, a little different brand, almost like, two cars, and one is a Honda and one is a Toyota, or whatever it may be. One seems to be, the veneer seems to be a little bit more custom made versus the lumineer, which is a little bit more ready to click and go. Is that what it is?
Well, both of them need to be custom made. Lumineer is just a type of brand. You need to take mold from the patients. Mm-hmm. This is what they are advertising. The company who makes Lumineer, they just take a mold of the existing teeth without dentist touching the teeth. They send it to the company, and then they custom made Lumineer for those patients. But these teeth have not been prepared. It means they have not been shaved off of the tooth structure. And then if the dentists have come to the conclusion that they need to shave the teeth in order to make the teeth straight, then they shave the teeth, then they make a mold of those teeth. They send it to any company, Lumineer or any other company. in order for them to prepare the veneers, which again they're going to be cemented or, in the layman terms, glued on the teeth.
Okay, I see. So, all right. So basically, if there is no grinding down, I think you call that shaving, if there's no grinding down of the teeth needed, a luminaire usually works just fine, and in that case, you don't need to grind the tooth down, because they're super thin, they just fit on it, and you, and by doing so, I guess you don't need any injections or stuff, because you're not really grinding the tooth down, where with the other one, you might need it. But again, it's an individual matter, and the doctor will need to see how you come out looking the best.
Yes, definitely.
Well, all right. Is there a major price difference between those two?
Not really. Not in my practice.
Okay. All right. Thanks a lot.
Thank you.